Hello everyone, I'm Dr. Sachin Ambedkar, uh, laparoscopic minimal access surgeon, New Delhi, from Moulton Hospital. My expertise is laparoscopic surgery, minimal access surgery, bariatric and robotic surgery, and the most advanced three-dimensional laparoscopic surgery. Today I am reaching out to all of you to educate about a very simple disease but yet very dreadful if it happens to your loved ones or yourself. So basically gallbladder stones. Gallbladder stones, whether should we get it operated or not, the fallacy and myth. This is what I'm going to talk to you about today. And hopefully, by the end of this video, you might have questions which were unanswered, are now fulfilled, answered, and you might have some knowledge. So, basically, most of the patients whom I've been operating and most of the patients whom I've seen come with me with ultrasounds which state that the gallbladder is having stones. Some of these patients are symptomatic. Symptoms such as nausea, vomiting, postprandial fullness, that means fullness after having heavy meals, pain in the night, and sometimes jaundice. So obviously these kind of patients need to be operated. But what about the other part of the patient, that percentage of patients who come to me with health checkups which state that gallbladder stones are there, but the patient has never had any symptoms? What next? Do we operate? Do we not? That is the question. And unfortunately, this percentage of patients would see the health checkup, go to their family physicians, and the family physicians only advises since you do not have any symptoms, you do not need to be operated. And the patient is very happy looking at this advice that he doesn't need to go under the scalpel or surgery. But, my dear friends, this is one of the worst mistakes anybody can commit. Reason because gallbladder stones, if left untouched, untreated for a very long time, changes the gallbladder's consistency and makes the gallbladder into a cancerous gallbladder. Yes, you heard me right. Cancer of the gallbladder is one of the common complications if the gallbladder stones are not operated. The other complications are, yes, pancreatitis. You might have septic shock. These are the dreaded complications which might land you even in the ICU. Now, what is the gallbladder? It's a pear-shaped organ in the body which collects bile, stores the bile, and helps in and aids in digestion. But sometimes when a patient has high cholesterol levels, these cholesterol crystals in the bile crystallize and form small, small stones, and then further on the bigger stones. So any patient who is very, very fat, obese, not having a healthy lifestyle,